This What's Working with Cam Marston podcast is brought to you courtesy of First Horizon Bank.
Hi, I'm Tabitha Scott, a human dynamics expert and the host of Bucket Listening, brought to you by First Horizon Bank. I hope you will join me as I sit down with people from all walks of life to learn how their passions, insights, and persistence have helped them turn their bucket list into a beautiful life.
Tune in on your preferred platform or visit firsthorizon.com/podcast.
Welcome everyone to What's Working. I'm Cam Marston. I'm so happy to have you along for the ride today. We're going to have another good show, a conversation that I suspect I'm suspecting, and I'll tell you more about this in a moment, that this is a forthcoming conversation you've never heard before. And I think it's one that's going to catch us all a little bit off guard, a little by surprise. I'll tell you more in a moment after I tell you a little bit about the show. For those of you who are new to the show, and there are more and more of you, What's Working is the show that focuses on workplace, workforce, and marketplace trends. Our goal is to find experts and guests that can talk about trends in such a way that we can understand them and utilize them in our own business, in our own world, in our own life. The goal, let's come out of the end of this hour being able to be a little bit better, just a little bit better at whatever it is that we do, and we'll get that way through listening to our guests and understanding how their world is changing, and we can apply that to our own world. And speaking of listeners, I told you more and more people were listening. I want to welcome the listeners of WKLW-FM. They take care of the Eastern Kentucky area, and I'm glad to have you on board. We got more coming. The ink is not yet dry on the contracts, or we're waiting for another signature on the contract as the show gets further and further out there. And very excited to have the new listeners. I think we're up to 20 different markets now, something like that, and I'll be able to announce those markets as they continue to come in. And so anyway, let's get into the show. The world of plastic surgery is something that I know very, very little about. And I had always assumed it was for the vain. And in talking with a guy not long ago, he told me that's not true, Cam. It's not true at all. And one of my observations about plastic surgery is it seems to be addictive for the people, and it seems to me to be primarily female, who get the plastic surgery. They want to come back and back and back. And if you can make my eyes look like this, then with another operation, another procedure, another little bit of money, you could do this more with my eyes. And then we'll do something else and we'll do more with my eyes. But Dr. Chris Park is going to be with us after the break. He'll update all of us on the new technologies available in plastic surgery, and repeat customers of his are largely because these new procedures are available that people simply don't know about. So Dr. Park has written a book about today's plastic surgery world, what's available, non-intrusive things, things that don't send you home with black eyes or deep bruises. Much of it really cutting-edge technology, and he's very excited about this technology. He's told me all about it. Some of it he'll explain to detail more of it, and he's very proud of his profession, very proud of the new technologies available and what they can do for people. So when we come back from break, I'll have Dr. Chris Park. He'll be talking about his book, which will tell you how to get a copy of that or where you can leaf through to learn some of these technologies, and he'll give you some in-depth detail on that. Also, in the very near future, actually, I guess this episode will carry this, you're going to hear advertisements for Mason Hills Farm. And it's direct farm-to-table stuff, grown here not far from where I live in the community of Grand Bay, Alabama. And Joey Mason was a guest on the show not too long ago, maybe a month, 2 months now, and talking about his passion, his dream of investing in farm-to-table beef. He now includes pork, and he includes poultry, and you'll hear them become a part of the show here in the very near future, if they're not already, as this show is broadcast. do me a favor, go to masonhillsfarm.com and check them out if you're truly interested in that farm-to-table stuff. So welcome to Joey. Welcome to the listeners of WKLW in Eastern Kentucky. We're glad to have you. When we come back from break, I'll have Dr. Chris Park. We're going to talk about the changing world and the new technologies of plastic surgery. This should be fun. This should be interesting. We'll be right back.
This is Seth Cherniak, Vice President of Branch Development for the Jeffrey Matthews Financial Group. If you're an experienced financial advisor wanting the freedom of independence, but aren't sure making that jump is right for you, we should talk. Jeffrey Matthews has developed a successful program for advisors who don't want to be 1099 contractors and don't want to pay for their own overhead. We're looking for advisors who want the freedom to run their business the way they see fit, with the support that comes with a W-2 firm. If you're interested in joining one of our branches, or if you want to open your own branch as a full-time employee, let's chat. Our compensation plan is one of the most competitive among all W-2 firms, big or small. Reach out to us today at jeffreymatthews.com, connect with me, Seth Cherniak, on LinkedIn, or click the link in the podcast.
Jeffrey Matthews Financial Group, member FINRA, SIPC. We're back. You're listening to What's Working. I'm Cam Marston. I'm in the studio with Dr. Chris Park. I think we can expect a pretty engaging conversation here just by looking at his bio. I'll pick and choose from it as we go along. Dr. Park completed his undergraduate education at the University of Virginia with a distinction as an interdisciplinary Eccles Scholar. He attended University of Alabama Medical School at UAB, where he received the Galbraith Award for Excellence in Surgery, then trained at Wake Forest University Baptist Medical Center in all aspects of plastic surgery, including reconstructive surgery and cosmetic surgery. It goes on. I'll pick and choose from it as we have time. Dr. Park, welcome to What's Working. Glad to have you.
Thank you for having me.
It's nice to have someone with such a pedigree locally in the studio and what you do for our community here, recognizing that so many listeners are not Mobile-based, but nevertheless, it's nice to have you in town. Let's talk about the discipline of plastic surgery, and maybe we'll begin with some of the most wide-held misconceptions of what it is. That sounds like a wide-open question, and I'll let you take it from there.
Yeah, well, I mean, plastic surgery is something I discovered in training, and I kind of had misconceptions as well about what all it does. And what I found amazing about it is the hundreds and hundreds and hundreds of different procedures that plastic surgery does. I mean, you can never get bored. There's so many things that you can get into to help people. We work head to toe. I mean, I've operated on neonates literally the same day they were born, all the way to people over 100 years old. All the way from the top of the head to the tip of the toes.
So it's truly thorough in what it is that you do. Where does the word plastic come from? You've got to have had that question before.
Absolutely. Plastic is from the Greek word plastikos, which means to mold. So it basically involves anything that we remold the body to either correct defects or deformities from trauma or cancer, or moving tissues around for aesthetic purposes.
How much of your work is trauma-based versus, is this correct? I want you to teach me how to talk about this, versus cosmetic.
Right. So we talk about reconstructive versus cosmetic. And in the reconstructive realm, it includes everything from trauma to cancer to anything that might have led to defects. And that's reconstructive and insurance-based. And then cosmetic is anything aesthetic.
You told me before we turned on the mics that you were on call this weekend.
I was.
And you explained to me what a call to you from a hospital could have entailed. which caught me off guard. I was unaware of the depth of what it is that you do. My suspicion is there are a lot of people out there who have my same innocence in this regard. Right. Give me a sense of what your weekend was like, what calls came in, what they were asking you to do, or a hypothetical of what it may look like.
Right. So, of course, we're covering all plastic surgery patients and issues they may have either while at home, they can call directly into the doctor on call, or they may be going to the ER, or they may already be at the hospital. And we essentially are their doctor for plastic surgery purposes. And new patients can involve everything from a baseball injury where the baseball hits the kid in the face, breaks his cheekbone. I mean, we fix every fracture above the clavicles. Well, not the neck, but we fix noses, cheeks, jaws.
So you're actually manipulating the bone.
Correct.
In those situations.
Orthopedic surgeons don't touch facial bones.
Yeah.
So we do all the same plates and screws and that they do or similar, but we're doing it on the face. We deal with dog bites. I mean, not just because it cut the skin, but a lot of times when the dog nips, it pulls skin away. And I mean, we may be doing a modified version of a facelift on a 9-year-old kid because he's missing 1.5 inches of skin in front of his left ear. So what I love about plastic surgery, it's really a specialty of learning anatomy and physiology, but then principles. I mean, my surgeries are never identical. I mean, I'm always just thinking, how can I solve this problem, which is what I love about it.
So what do you mean principles? Give me more detail on that.
Well, the example I just gave is, so I know exactly how to do a facelift. Most of them are elderly patients. But when you see holes or defects in somebody's face, you may use the exact same principles in a different manner. Just like people, as you thought, we don't just do cosmetic surgery. And so just breast reconstruction, for example. I mean, we obviously rebuild breasts from the ground up many, many times. And I often new techniques and technology and things are developed for that, and we'll incorporate that into aesthetic breast surgery. I mean, like you said, most people just misunderstand. They think plastic surgery is putting a breast implant in the breast. I mean, That's the simplest, smallest facet of what I do. And even if I am putting a breast implant in to make a breast larger, I've probably done a whole bunch of other things during the same operation to get it ready. And then the implant just adds volume. But I've still moved stuff around, tightened things here, changed angles there, and then the implant just kind of gives the volume.
I've heard orthopedic surgeons who walk with their knuckles on the ground and breathe through their mouth mostly. I know your brother's an orthopedic surgeon, and we have a lot of mutual friends that are. They've described themselves as carpenters. Are you an artist or a carpenter?
Definitely more of an artist. I mean, absolutely.
Yeah.
That's what I love about it. Just you, like I said, you look at something and your brain has to think how to fix it.
In front of me here is the book that you've written, co-authored, if I'm reading this correctly, called Beauty by Design. And tell me about the book and then the motive of the book.
Absolutely. Even my wife doesn't know all the things that a plastic surgeon does. It's amazing the number of procedures. And that's what I love about it. And so I had two main mentors in my career. One was Louis Vasquez, who's the head of plastic surgery at UAB. And the whole reason I went into plastic surgery, I was going to do something else. But then Malcolm Marks was my main mentor at Wake Forest. And he is one of those people like me that just love challenges, never gave up a single facet of plastic surgery, was still doing everything from cleft lips to cosmetic to major cancer reconstructions, even when he was 70 years old. And we just kind of said, the world needs an easy, palatable, digestible version of the things that we do that's kind of fun to read and informative. It's not meant for people to go memorize the book, but it's kind of like a reference book. You can kind of say, do they do anything for arms? Oh, yeah, here's a chapter on arms. Do they do anything for hair loss? Oh, yeah, here's a chapter on hair loss. I mean, we do so many things I can't list it. And so the book kind of helps people to understand what we do.
Is medical school an effective way to learn all it is that you do? I had a guy on the show a couple weeks ago named Robert Pearl. He's a professor at Stanford, and he teaches in the healthcare world, and he's a MD. He says that medical school is no longer an effective way to learn how to be a doctor. And I'm looking at your book here and all the chapters and everything in it, and I think, can medical school accurately and effectively teach all this stuff? Or does it require you to get in there and get your hands dirty in order to learn this stuff the best? That's a very loaded question. What do you think?
That's a fantastic question. I will tell you, medical school has almost nothing to do with plastic surgery. I mean, medical school is like going to prep school to learn the grammar and how you put the words together, but then you still got to go learn to write. So in medical school, you're going to learn the physiology, you're going to learn the anatomy, you're going to learn what blood vessels go to what muscle or this skin or that and where the nerves are. But then that's all just in the back of your head. And then, residency's always been to go beyond medical school and teach you your own specialty. But, plastic surgery is not a core subject matter in medical school, meaning most medical students never spend a single second in plastic surgery.
We're going to be back after this break with Dr. Chris Park again, learning the ins and outs of plastic surgery. I have a couple of very specific questions, particularly. I always assume females are the primary customers of plastic surgery. I'm wondering what he does for men. Let's ask him that when we get back from break. Before we go to break, I want to remind you about the podcast from First Horizon Bank called First Horizon Bucket Listening. It's an interview of CEOs who have chosen to make their bucket list a part of their career. Why wait till the end? First Horizon says you can do it now, and First Horizon's got a banker that'll help you do it. Find First Horizon's Bucket Listening podcast wherever you get your podcasts. I've checked them out. They're well worth your time. We'll be back after this break with Dr. Chris Park.
This is Bill Eastet. I perfected my baking recipe behind my live music stage at my little restaurant in Fairhope, Alabama. We have custom-made smokers and small batch bacon made just for you. So if you're looking for the best bacon in America that has been cured, smoked, and even serenaded by songwriters, you definitely need to try Billy's Small Batch Bacon. www.billysbacon.com.
You're listening to What's Working. I'm Cam Marston. We're in the studio today. I get the wonderful opportunity to look across the table at the guest versus on a Zoom call. I'm with Dr. Chris Park. We'll pick up a little bit on his bio. Let me see if I can read this. The reason that Chris chose plastic surgery is that it maintains an entrepreneurial opportunity to run and grow your own practice. I guess there's a lot of opportunity here to talk about that with you, Chris, and it's a business-oriented show. Pick up another place in the bio. He served as a clinical instructor at Wake Forest after getting your own degree. So you're like one of these Navy pilots. You learn to fly the jets, and then you come back and teach the pilots or the trainees how to fly them. Obviously well qualified. We were talking prior to break about the stereotype, I guess it is, that females are the primary target for your practice. However, I'm learning more about the trauma work, if you will, that you do. What do men? Do you have very many men elective customers that aren't there due to a dog bite or a bone break?
Yeah, I mean, so we have lots of men in the practice. Half of them are there for things that come up with age, such as skin cancers, those sorts of things. But aesthetically, we do men all the time. I mean, the most common procedures for men are the upper eyelids, where they get excessive or hang down. Sometimes even insurance covers it. Usually it's cosmetic. Rhinoplasties, changing the shape of the nose. Obviously at a younger age, in the teens or 20s, it may be purely for cosmetic purposes, but also as men age, our noses can get quite large.
Do they continue to grow like an ear does?
They do.
Really?
Do. Yes. And the skin thickens. And so we do a lot of rhinoplasties in men, even if they're not a quote unquote vain person, but it just makes them look much more like themselves. Liposuction is not uncommon among men. We do non-surgical things like hair replacement. You can do hair transplants, but now the technology is getting more and more where there's topical uses and injectable things that can help the hair regrow without any surgery.
I listened to a wonderful podcast months ago from the Huberman Labs, if you're familiar with that guy. And it was downloaded a quadrillion times because it was on hair loss in men. It's like no one wants to get caught listening to it, but everybody is listening to it. What is the common question you get, the most common question you get?
Besides, what do I need done?
Where they come to you, they stand in front of you and they say, what do you think I need?
Well, it's usually more social when people ask that in a funny manner, which is obviously a difficult time to answer. The most common thing we see, actually saying, how can you help me, is usually it is women, as you mentioned, after pregnancies or after just done with children. It's also after that early mid phase of life where a lot of things change on the body. And, we often are tweaking breasts or bodies often at the same time. Some people call it a mommy makeover. And that doesn't mean one specific procedure, but, do you need a breast lift? Do you need breast implants, breast reduction if they're too big? Removing skin on the stomach for a tummy tuck, or just liposuction, all those things. So that's the bread and butter. I mean, that's what I do 50% of my time.
Really?
Yeah.
Invasive versus non-invasive. You and I talked before the interview began that there's now some remarkable technology out there that prevents you from having to touch any of your cutting instruments. Tell me about that.
Yeah, I mean, it's started, I guess, kind of gradually with things people know. I mean, Botox and fillers are amazing for what they can do, and I can't even imagine what it was like without it. So Botox relaxes muscles that cause wrinkles that we don't need. So around the eyes, the crow's feet, between the eyebrows, you relax those muscles and those dynamic wrinkles go away and things look a lot smoother. Then for static wrinkles, we have injectables, but that's all old. You probably already know about that. That stuff's been out 20 years.
Yeah.
Then we've gone into things I never thought would exist 20 years ago. So we have non-surgical means of killing fat. It did start with like some injectable things, which was called mesotherapy, which wasn't actually great or safe or didn't look good. And now there's both heat-based technology and cold-based technology that literally will kill fat without surgery. And then the fat dies and your body kind of cleans it up and washes it away. And then the next frontier was, skin tightening. I mean, almost everything I do involves removing skin, whether it's facelift, breast lift, tummy tuck. And we're getting more and more technology that tightens the skin by usually heat-based in order to remodel collagen and make it tighter and more elastic. However, when it first, everything has a curve. In the first 10 years this stuff came out, it all hurt a lot. I mean, we would have companies come in, we'd try them and demo and play with them. And I was like, this hurts. Like a patient would rather be asleep, because the concept is be awake. I'm like, they're going to need to be asleep for this. And if they're going to be asleep for this, I can do surgery and get a more dramatic result. But it really just in the last couple of years, we've gone over that hump where we have several machines that will do skin tightening or kill fat without pain.
So the patient will come in and sit down, lay down somewhere, and the machine is put directly, let's talk about the fat burning or freezing. The machine is put on their body, or is it isolated? Or they sit down somewhere and you move the machine to them. How does that work? I'm trying to picture that.
All right, so basically imagine an octopus kind of situation. The machine has the technology, but it's going to have some flexible arms that we attach to a certain area. Cool sculpting, for example, almost everybody knows that word. The company blew up, and it's amazing. But it actually, you put in an applicator on, it sucks the skin up and then gets it so cold that it gets real cold, and then it goes numb after a few minutes, and then it stays on for 25 minutes. And during that time, it's getting cold enough to literally rupture the fat cells. They blow like a bubble, and then your body clears it. Similarly, the newest technology we have is called TriLift. It's a combination of microneedling, which is little tiny needles that have radiofrequency energy on them, muscle stimulation. So people have heard of a TENS unit, which makes your muscles contract, but this actually does that to the muscles in your face. And then external radiofrequency to the skin. And you combine those three things, and it's a mini facelift without pain, risk, or recovery. I mean, it's amazing.
Did you say radio frequencies?
Yes.
Through the needles?
Yeah, we do a lot of the things I talked about, the radio frequency heating that would hurt, is external radio frequency, just, basically vibrating so fast that it's getting hot, and that's what hurts. But then we came out with radio frequency microneedling. So the initial part of the needle is insulated, not hot, goes under the skin where there's not as many nerves. The skin is full of nerves. And then that part has the radio frequency. And it gets really hot, and it's kind of melting underneath the skin, melting a little bit like some of the fat turns into butter. And then the skin gets hot enough that the collagen, we all know burns can lead to tight scars. So you're basically using the heat to, in a controlled manner, burn the bottom of the skin, and then it tightens up.
Do you fear, let's take this, is this going the route of the hearing aid, where it used to take a doctor's prescription and a doctor visit to get a hearing aid, to now that they're over the counter at the local pharmacy or the local CVS? Do you fear any of this technology is going to become so democratized that I can go to CVS or Walmart and get some sort of octopus thing that I can put on my fat?
Fear it? No. The main thing, I know exactly what you're asking, and the thoughts have gone through every plastic surgeon's head. But the truth of the matter is, nothing can replace what we can do with our fingers. There's way more people out there that need help than plastic surgeons can do. And if somebody can do a treatment that makes them feel better, for a little while, that's not a problem.
Yeah.
It's just, the skin has a limit on what it can do. I mean, it's not like this mini facelift, tri-lift machine I talked about. You can do it forever and ever and stay young. I mean, eventually the skin loses its ability to contract. We call that elasticity.
Right. So at some point, it's diminishing marginal returns. You get hear these stories about people that become addicted to plastic surgery. If that investment in myself looked good, then this next investment in myself is going to look even better. And they come out looking somewhat freakish.
Yeah, I can't say I've seen a lot of that. Both, obviously, I wouldn't do that.
Right.
And also, it's just not the mentality here of our type of clientele.
We'll be back after this break with Dr. Chris Park. We're talking about the world of plastic surgery and busting my stereotypes on what I thought it was. And I suspect many of you out there are learning the same thing. We'll be right back. You're listening to What's Working. I'm Cam Marston.
This is Seth Cherniak, Vice President of Branch Development for the Jeffrey Matthews Financial Group. If you're an experienced financial advisor wanting the freedom of independence, but aren't sure making that jump is right for you, we should talk. Jeffrey Matthews has developed a successful program for advisors who don't want to be 1099 contractors and don't want to pay for their own overhead. We're looking for advisors who want the freedom to run their business the way they see fit, with the support that comes with a W-2 firm. If you're interested in joining one of our branches, or if you want to open your own branch as a full-time employee, let's chat. Our compensation plan is one of the most competitive among all W-2 firms, big or small. Reach out to us today at jeffreymatthews.com, connect with me, Seth Cherniak, on LinkedIn, or click the link in the podcast.
Jeffrey Matthews Financial Group, member FINRA, SIPC. We're back. You're listening to What's Working. I'm Cam Marston. In the studio today, across the table, not on a Zoom call, from my guest, Dr. Christopher Park. He lives in Mobile, Alabama, where this show is produced, and is absolutely qualified to talk about the world of plastic surgery. I hold in my right hand his book called Beauty by Design, The Artistry of Plastic Surgery, as he said a moment ago, written to tell people like me, hey, this is what we do. It's not what you think it is. This is a little bit more about what we do. His major interests include propelling the reconstruction of major defects due to cancer, trauma, and degeneration, skin cancer, and the full breadth of cosmetic surgery, including facial, brow, eyelid rejuvenation, cosmetic breast procedures. It goes on and on. Minimally invasive techniques include peels, lasers, fillers, Botox, fat injections. Chris, so much there. Right. Most of the plastic surgery, well, let me ask you this. You mentioned the the hot and cold treatments.
Yes.
Is it reasonable to think that people will leave your office looking differently after those? Are they instant results?
Most are not. Some are. Like our newest machine is basically a mini facelift with no pain. And even we had an open house last week, and even patients were walking out of the open house looking younger. And the reason we jumped right on it, A, it didn't hurt like we talked about, but B, like we were doing halves of faces during our demo, and you could see the difference on the actual patient.
That sounds funny to me.
It does. We would finish the other side later, but we would all do one side and then, give it a day and kind of enjoy the difference and then finish it up.
Miss Jones, we're going to do the first half of your face, and if you want the second half done, you're going to have to pay for that half.
When facelifts first came out, people took so long doing it, they would do one side at a time.
Really?
Years and years ago.
So do you offer, I imagine many of these facilities offer all kinds of care and attention to the patients and stuff like that. I imagine that's got to be a big part of your pitch to the public is we're going to treat you well while you're in here.
Right. And that's and again, making it hurt less. It's always the goal of surgery, but especially with these less invasive things. And we absolutely want you to feel pampered when you're with us.
Where's the technology taking you? During the break, we were talking about you writing the book and then having to rewrite chapters due to new technologies. Where is the technology going?
It's amazing the change we've had in 20, 30 years. It's, we're going to use more and more, all the things you hear about in medicine. We're starting to use some robots in plastic surgery. Lasers were the new frontier 20 years ago, and not just lasering the skin, but like actually using the laser during an operation. All of this technology, I think, is reducing risk and recovery and will all be added together for kind of a cumulative effect. After opening, I had to add a medical spa. That's not like a spa and hotel, but it's basically a whole feature of what we do that does not involve surgery. And it involves a lot of these machines and some estheticians and people that take care of you without the scary surgeon walking in the room with his white coat on.
Yeah. What about body parts? What's your next focus? I suspect that the profession has been around long enough that the most readily targeted parts are hit on a regular basis. But do you see new things coming on? Here's a way to help your hands, your arms, etc.
Absolutely. We already do tons of extremities. And also the other thing, I don't want to take too much time, is all these weight loss patients. It used to, they're everywhere, but it used to require surgery. But now all these new diabetes medications where people are losing 100 pounds over 6 months, all that skin has to be addressed, and that's an obvious thing, and it affects everything. But to answer your question, yes. There's so many procedures out there for hands. Our hands age not just because of time, but they're in the sun more than everything else. If you're wearing long sleeves, we'll even see left hands a lot older than right hands from driving and having it on the window.
Interesting. So what would you do to a hand? Give me an example.
So there's lasers we can do, but then also there's little tiny places we can make incisions and excisions of skin to flatten out the wrinkles in the hand. We also can inject filler or fat to kind of plump them up as hands age. And you can imagine anybody in your family that you want to think about, don't name them though, where they start to sink in and you can see the veins and the tendons even will stand out. So basically filler or fat can be added as insulation or plumping that kind of hides what's going on underneath. So injectables, surgery, and lasers.
What about disease? And I have a friend that's a dermatologist, and after this conversation, it might be interesting to get him on to talk about the changes in his practice. And he's able to walk up to people, and he tells these stories infrequently and say, listen, I know what I'm talking about, and that whatever on your arm, your leg, your face needs to be looked at.
Absolutely.
Do you have similar kind of Hippocratic Oath responsibilities to address things like that to people?
We honestly have the exact same one in addition to many others. I remove skin cancers half of my time in the clinic.
Really?
The dermatologists do most of the screening. Most of them won't cut one off on the face or neck, and they send all of those to us. But then a lot of those patients just come to us from the get-go. I do recommend everybody see a dermatologist, but a lot of them just say, well, you're going to be cutting it off, so I'm just going to come to you. So I diagnose as many skin cancers as a dermatologist does.
Do you really?
Yeah.
See, this is a part of the world that you live in that I knew nothing about, which is I guess I'm guilty of the traditional stereotype.
It's everyone.
I know where your building is, and I know what goes on in there. I'm obviously very wrong about that.
Tip of the iceberg is all you know about.
So one of the things you mentioned during the break was the social media push, that you're trying to use the bullhorn of our time, which is social media, to tell people more about what you do, correct?
Correct.
How's that going?
For better and for worse. I will say I'm a little bit old school doctor and like to keep things professional, but, social media is everywhere. And just as much bad information, probably more bad information goes out than good information. So we at the Park and Rebo Clinic, especially with Dr. Rebo, my younger partner, are really trying to get on there with educational content. We have the Park and Rebo Clinic on all the social media platforms. We each have our own pages, Dr. Christopher Park and Dr. Ryan Rebo. And even on TikTok, you got to do the goofy stuff on there. We're called the Bama Boob Docs, which again, fights my nature a little bit. But just trying to show people safe, educated options.
Yeah.
Because people are, you don't want to know. People are going to hotel rooms in some cities and having stuff done by quacks.
You know what? I thought these were just urban myths. You're giving them legitimacy. People are doing this.
Absolutely. People get on illegal substances till they're basically unconscious and then having non-medical grade things done to them. Even worse than that, and we don't have time to discuss this, but there are even real plastic surgery clinics, maybe not run by a plastic surgeon, in a lot of big cities, and Miami is the worst one. I am not exaggerating when I tell you that there are at least 3 infections, complications, or problems brought to a emergency room in our city that had surgery in Miami every single week.
No kidding.
Every week.
So I'm going to hustle down to Miami. I'm going to get this done because it's cheaper down there.
Yes.
And even though it's done in a container crate that's next to the highway,
right,
it's cheaper. I'm making something up here.
No, it's true.
And I'm going to come home and have to get it the infection fixed.
Like death risk type infections we've seen. And to make it even scarier for patients, some of them are in a real clinic, or it's called plastic surgery clinic. Some of them even bring in a plastic surgeon, a day a week or a couple days a week. There have been a bunch of crackdowns in Florida. There's been a bunch of deaths. There's been proof that there's 15 surgeries that take 3 hours each, done by the quote unquote same surgeon on the same day, which is mathematically impossible. Right. They're having these assistants do these things. We don't want to get into it, but there has been some bad stuff. There was one day the air conditioning was broken at one of these clinics. 13 women had surgery. All 13 were in hospitals in their own separate towns the next week, and several of them died.
Oh, my gosh. Well, this is not the great note to finish the show on. But, folks, we got incredible expertise here. Nothing done by the sleight of hand here. How can they find you, Dr. Park?
Easiest way to find us at this point is digitally. Parkrebo.com is our website. We got the Park and Rebo on all the social media tags. Phone number 251-340-6600. Email us at info@parkrebo.com. We love talking, as you can tell.
The book is called Beauty by Design, The Artistry of Plastic Surgery. Dr. Chris Park, folks, you'll find all the links to the things that he said in the show notes of the podcast. Come find the podcast if you're listening to the radio broadcast. You're listening to What's Working. We'll be back after this break with final comments.
I'm Joey Mason. For 4 years, my goal has been to produce the best farm-to-table products I'd ever eaten. I've done just that at our on-site USDA facility in Grand Bay, Alabama, allowing us to ship directly to your door. This is true farm-to-table. Visit us at masonhillsfarm.com to see all that we have to offer.
We're back for segment 5. For my regular listeners, you know that segment 5 is when I kind of try to boil down what I learned in the show and what we can take away from it. And what I learned here is the extraordinary breadth of what plastic surgery can do for any one of us is much more than what I had initially thought. As I said during the show, I thought that people, primarily females, show up at the clinic and they get cosmetic surgery done that will enhance their look. It's ego-driven stuff. And after the microphones went off and Dr. Park and I were done with the interview, he told me a good bit about the world of skin cancer that he is involved in removing those from patients and the frequency with which he does that, the delicate nature of a lot of these cancers on very thin tissued parts of the body and the delicate work that he does in there. In other words, there was a whole lot more that he does that I was unaware of. And he told me as he was leaving the studio that one of his reasons for wanting to do the show is to help people understand the extraordinary depth of detail of what it is they do. I think he said when he got here and we started the show, 400 different types of surgeries. There may be other surgeons out there that do that many different types of surgeries, but 400 certainly took my breath away. And Dr. Park is trying to dispel the myth of what it is that they do and educate people more on the full scope of things that they do. And again, I refer you to the book, Beauty by Design. If you're wondering what he does, my suspicion is you can find it in this book. My further suspicion is this book, based on the rapidly changing technology that he discussed, is probably nearly outdated if it's not outdated already. Anyway, I guess the point we leave with is if you're wondering if a plastic surgeon can help me, the answer is probably yes. And don't think it's not. Go get an opinion, have it looked at. Do not go to a hotel room in Miami to get this done. I don't think we really need to say that, but perhaps it's worth saying. All right, that'll wrap the show up for this week. As I said, all the contact information for Dr. Park, his practice, and I recognize many of you listeners aren't in Mobile, but all that contact information will be in the show notes. If you want to figure out how to get the podcast, pull up your web browser, go to what'sworkingcam.com, and in there you'll find the show notes, a little description of what we talked about, and the links to the different things that he referenced, where you can follow him on social media, learn more about him, find the information on his practice, etc. It will all be there. I encourage you to go take a look. Again, that's what'sworkingcam.com. If you have a message to send me directly, you can go to that same webpage. We've got a way for you to reach out to me or email me right now, wherever you are, cam@cammarston.com. Let me know what you think, information, feedback, whatever. You can go to the webpage, cammarston.com, enter your email address, and you'll get the first chapter of my book called What Works? The 10 Best Ideas from the First 200 Episodes. Again, cammarston.com, enter your email. You'll get the first chapter of the book. Love to have you take a look at it and let me know your thoughts. Find us on social media, all of them, the same ones that Dr. Park mentioned. We're on there as well. We'll have another show next week. Have a good week, everybody. As you likely know, this show originates as a radio show broadcast across the state of Alabama, and it continues to grow in both radio listeners and market. After it's formatted for radio, we then turn it into this podcast. Please share it with those you think would find it interesting, and subscribe to the podcast on my YouTube page where you can leave messages and your thoughts and your comments, and I'll certainly get back in touch. Finally, if you're a fan of the show, please offer a review on Apple Podcasts or Spotify. You can find my book called What Works on Amazon.com. In it, I highlight the top 10 ideas from the first 200 episodes of the show. Mind you, they're not the top 10 best episodes, they're the top 10 best ideas. Many times the same ideas are brought up again and again by different guests, and we dig into those ideas in such a way that they'll be easily applicable for your business. Simply go to Amazon and enter my name, and you'll find What Works as well as my other books. Chapter titles include How to Find a Niche, Innovation, Building Teams, and so forth. To learn more about the workshops and seminars I offer, go to cammarston.com. There you can view clips of my work, view workshop titles, view my reviews, case studies, customer lists. It's all there. If you'd like a free copy of one of the chapters of my book, enter your email address at the bottom of the homepage at cammarston.com. And from that site, you can email me directly. I always love to hear from you. You'll also find me on social media, Find Cam Marston on all the social media platforms, and you may need to enter the numeral 1. There's one other Cam Marston out there, and that numeral 1 distinguishes me from him from time to time. So if you're unsure if it's me or not, enter that numeral 1 after my name, and it should do the trick. On a more personal and less professional side, I record weekly commentaries that air across Alabama on Alabama Public Radio twice each day on Fridays called Keeping It Real. They've won statewide and national awards. They're simple observations on the world as it goes on around me, and they're only a few minutes long. They're a passion. You can find them on the same podcast app you're using to listen to this. Finally, if you're interested in advertising on this podcast or the radio show, reach out. I've worked hard to cultivate a specific listener, and I can tell you all about them, and I have many different options for helping you reach them. Thanks again for listening. We'll have another episode available soon.